Uh, Hello everyone, and this is Dr. Manoj Gedam. I am consultant endocrinologist and diabetologist at Apollo Hospital, Indore. So, the purpose of today's interaction is to increase awareness regarding the diabetes in the general population. Diabetes, as you know, is a growing concern, is a growing pandemic all over the world. And India, it has the second largest number of people living with diabetes, just after China. And after the recent pandemic of COVID-19, there is significant increase in the number of people with diabetes. Many of the people, they have developed new onset diabetes. So we are aware of that concern. So one of the very important aspects of diabetes regarding the for Indian population is that many of the people with diabetes, they are not aware of diabetes, whether they are having diabetes or not. And the consequences of this asymptomatic or the we call it pre-diabetic the population is that these people, they have increase in their blood sugar level, and there is ongoing organ damage, and which people are not aware of the same thing. And by the time people, they come to know that their blood sugar level is high, and their blood sugar level is high, and they have developed the symptoms, already the increase in the blood sugar level has caused the significant underlying organ damage. So we have to diagnose these people who are having pre-diabetes, or who are not aware of these complications. So the purpose of today's interaction is to increase awareness for the screening of the people for diabetes. The Western population, they have different kind of clinical presentation for diabetes. And if we talk about the Indian population, we are much more susceptible to diabetes as compared to our Western part, because Indians, they have some different kind of genetic makeup. They have very less beta cell mass, and very less muscle mass also. So we develop diabetes at an early age. So in the Western population, they screen the population after the age of 45, but because we develop diabetes at around 10 years earlier than the Western population, we should screen every individual who is above 30 to 35 years of age, and particularly those who are having a risk factor for diabetes. Risk factors like increase in the body weight, those who are obese, those who are having family history of diabetes. All these patients, all these individuals should be screened for diabetes. And if they are found to have diabetes, or their blood sugar level are raised, they should consult the respective doctor and should follow the advice. And those who are not having those who are having blood sugar level under control, they should follow up. They should do yearly testing for the screening of diabetes. The other aspect of for today's interaction was to increase the awareness regarding those who are already having diabetes. So we have seen that those patients who are having diabetes, they have very poor sugar control. Many of the patients who are coming in our OPDs, they are having blood sugar level in the range of 300 to 400 range. So people need to understand that as the blood sugar level increases, as their blood sugar level will go to a higher level, the organ damage will increase subsequently. So people will develop blood pressure, people will develop heart attack, they will have stroke, they will have kidney damage, then the damage to their eyes and damage to their nerves. All these complications will develop. And previously we used to talk about, in case of diabetes, we to talk about sugar control. But now the concept is that the diabetes management is not just sugar control. We need to take care of the blood pressure also. We need to take care of the lipid profile also. and the other aspects also. So for all the patients who are having diabetes, I will emphasize that not only you should control your blood sugar level properly, but also the control of your blood pressure and your control of your cholesterol, and everything is very much important, like the control of blood sugar level. For that, the regular follow-up of the patient to the doctor is very important. I have seen that many of the patient, they are not following. They follow at yearly or 2 year, 3 years. They are continue to take on medication or whatever they were prescribed. So that is not the proper way of managing your diabetes. You should follow up with your doctor regularly, so that the control of your sugar level should be proper, and appropriate change in the medication should be there whenever it is required. And those who are already having diabetes, they should educate their relatives, their peers regarding the screening of diabetes. As I said, it is very much important for the early diagnosis, because in our society the awareness of diabetes is very poor. Even the scale of the problem is so much high. We have number of medications which are coming to the market. We have so much innovations, newer modality of treatment they are coming, but still our control of diabetes is very poor. And as I told you, diabetes is the mother of all disease. You ask any of your cardiologist, any of nephrologist, most of the patient of those who are developing any cardiac problem or any renal problem, most of their patient, they are having a diabetes mellitus. So if you control the blood sugar level at the earliest, you can very well control the future development of all these complications like renal disease and any cardiac issue. I would advise you to take care of your diabetes. And